Welcome everybody to our Council on Criminal Justice and Behavioral Health full council meeting here on December 10th, 2021. My name is Brenda Graylish and I am the Executive Officer of CCJBH and really excited for today's presentation. Hard to believe that we are winding down our calendar year 2021, about ready to head into 2022. As always, so much going on, and all that excitement always ends up leading us to December very quickly. So here we are again, really enthusiastic about presenting these presentations today with our lived experience contractors and all the wonderful work they've been doing throughout the year, and something we've been looking forward to having at our council meetings so that we can brief our council members on all of this wonderful work that they're doing and how they've been helping us as our council throughout the year. Next slide, please. Just a few notes of housekeeping. This meeting is being recorded, and we ask that you use the raise hand feature to make a comment if you have a comment. You'll be placed in line in the order in which the request was received, and when it's your turn to comment, our meeting host will unmute you and announce your name and let you know that you're free to speak your thoughts. Please keep your comments to 3 minutes or less, just because we have so much content. It's a 2.5-hour meeting. Seems like a good chunk of time, but it always goes so quickly, and so we just want to make sure we have enough time to cover the material. As always, if we don't have enough time to cover all the material, you have more thoughts that either weren't covered during this meeting or you just have some thoughts after the meeting, always feel free to email us at ccjbh@cdcr.ca.gov. And just wanted to actually circling back to the comment period, just that we will have somebody timing those comments, and so just kindly noting that it's really just to help everybody and not meant to be off-putting in any way, but just to help keep us all on time in a helpful way. Next slide, so we can go over the agenda. So we will do our welcome and introductions. We'll go through the roll call, and then we will approve our meeting minutes. We might, I guess, where are we at with that, Monica? Do we have a quorum, or do we need to hold off until Anita's able to join?
We have a quorum.
We do. Okay, thank you.
Tracy just joined.
Oh, Tracy's there. Okay, great. Welcome, Tracy. Thanks for joining us. Okay, we'll be able to get the meeting minutes done at the beginning of the meeting, and then we'll do our public comment on the meeting minutes and then take the vote. And then we will move through to our feature presentations today from our lived experience contractors. And it's both from our regional lived experience projects as well as our projects with Sac State, CSUS. So I'm excited to have everybody hear about that. Next slide, please. And then we will move to our, after we do the open discussion on that with our council members and public comment, we'll move to our business meetings. So we'll be looking at kind of a year in review and talk about some, have the council members talk about some proposed projects. We've done some work to look at the work that's been done to date, plus what we put in our ledge report, our annual legislative report, and try to map out our council meetings for 2022. So looking forward to having some discussion with all of you to get your input on that, and we can adjust accordingly. And then we'll take public comment, and then have a couple announcements and adjourn for the day. So with that, I will do the roll call, and then we will do the meeting minutes. I guess first, Undersecretary Tosh, would you like to just say a few words to welcome everybody today, since on behalf of Secretary Allison?
Yeah, thank you, Brenda. And boy, we have a full meeting today, so I'll keep my comments very, very short. Really looking forward to hearing all the presentations, and again, like to thank everyone for attending and continued attendance at our full council meetings. Thank you.
Thank you so much. Okay, so with that, I'll do a quick roll call, and then we will move to the minutes. So for roll call, I guess Undersecretary Tosh for Secretary Allison.
Present.
Great. Christina Edens for Director Clendenin.
Here.
Okay. Councilmember Denitza Pantoja, Dr. Pantoja. Not here because she is not able to join us today. Councilmember Anita Fisher. Not present at the moment, but expected in a half an hour. And actually, Monica, can you confirm? I think she probably emailed you to just let her know we got her note. Director Dr. Tony Hobson.
Present.
Welcome. Retired Chief Mac Jenkins. Not on yet? Okay. Dr. Jim Cooler for Director Michelle Bass.
Good afternoon, present.
Hi there. Judge Stephen Manley.
Present.
Great. And District Attorney Tracy Whitney.
I'm here.
Oh, great, Tracy. Thank you. All right, with that, we do have a quorum for our meeting minutes.
Brenda?
Yes. Oh,
Can
hey, you're here.
Yeah,
Yay.
I just landed at the airport, so I am present.
Oh my
So
goodness.
in a minute, I'll be transitioning to my laptop at home, but I'll be
Okay,
on mute.
okay, no worries. Thank you for joining us today. Sounds
There's
like you are
commitment.
busy. Yeah, that is commitment. Exactly. That's wonderful. Okay. All right. Let's move to our October full council meeting minutes. Do I have a motion to adopt our October full council meeting minutes?
So moved.
Okay. And do I have a second?
Second.
And that was that Dr. Hobson?
Yes.
Okay. Wonderful. Okay. Let's do a roll call. Or I'm sorry, public comment. Any public comment? Okay. Hearing none, we'll do a roll call.
Yes.
Okay, thank you, Monica. Undersecretary Tosh?
I approve.
Thank you. Chris Edens?
Aye.
And then Dr. Pantoja, not present. Councilmember Fisher, not present. Dr. Hobson?
Aye.
Chief Jenkins?
Aye.
Thank you. Dr. Cooler?
Aye.
Wonderful. Judge Manley?
Aye.
Great. And District Attorney Whitney?
Aye.
Oh, wonderful. Okay. The October 29th full council meeting minutes are approved. Moving on to the special council meeting that we held to adopt the ledger report. Recommendations. So a motion to adopt the November special council meeting minutes. Do I have a motion?
So moved.
Oh, okay. We'll take Judge Manley. Who else did we have for a second?
Second. Tony.
Tony. Okay. And public comment? Hearing none, we'll move to taking the vote. So Undersecretary Tosh?
Aye.
Thank you. Actually, it's Chief Deputy Edens now.
Aye.
Sorry, I missed that, Chris, in the beginning. And congratulations again. And Dr. Pantoja, not here again today. And Councilmember Fisher, not present right now.
Yes,
Dr.
I'm
Hobson?
here and yes, hi. I'm on. And
Wonderful.
yes, is I.
Aye. Okay. Thank you so much. Thanks so much for joining. We're glad to have you here today, Nita. Dr. Hobson.
Aye.
Wonderful. Chief Jenkins.
Aye.
Dr. Cooler.
Aye.
Judge Manley.
Aye.
District Attorney Whitney.
Aye.
Wonderful. Okay. And so the special council meeting minutes are adopted. Thank you so much, everybody. Next slide, please. So very excited to again have our lived experience contractors here today. You know, I've been in this role now for a little bit over 1 year, and so coming on board, you know, from being a council member to being the executive officer, I know one thing that I didn't have a real good handle on yet when I was a council member was all this wonderful work that the lived experience, our regional lived experience contractors and our Sac State lived experience contractors have been working on, or we're ramping up, or starting to really depart on. And so had the wonderful pleasure this past year of working with and learning from our different lived experience projects that have been really taking off this past year. And so very, very excited to be able to share this wonderful work with our council members. We felt that it was a great opportunity kind of as we're rounding out this year, and there's been so much work that our council has done. And our lived experience contractors have really been instrumental in the success of a lot of those projects. So, and in addition to helping us with our projects here at the state level, they've been engaged in a lot of projects at the local level as well. So I know we have a lot to cover. Without further ado, I'm just going to let us just jump right into it. Just a little quick note that for our participants who are joining us today, first off, welcome. And second off, we are going to just move through all the presentations from all of our lived experience contractors, and then we'll open it up for questions at the end. So if it feels like we're just kind of moving from presentation to presentation, we are, just because we want to make sure that we have time to cover all the material and then can do questions at the end. So with that, I will turn it over to Liz Kroboth from the Transitions Clinic Network to share with us all the wonderful work that they are doing. So welcome, Liz. And it looks like Jonathan Chu is also here with us today. And so Liz, I'll leave it to you to introduce Jonathan throughout your presentation. And thank you both for being here.
Great. Well, thank you for having us today. And again, yes, I'm Liz Kroboth. I'm the California Program Manager for Transitions Clinic Network, and Jonathan Chu, our Reentry Hotline Coordinator, will also be co-presenting with me as well. So we can go to the next slide. So yeah, so today we're just going to be sharing some background on who TCN is, some highlights of the work that CCJBH has funded us to do, and what's coming next for next year. Go to the next slide. There we go. Great. So yeah, just to give a brief overview about who Transitions Clinic Network is. So we are a national nonprofit. We run a national network of primary care clinics that have implemented TCN's evidence-based model of care for people that are transitioning from incarceration. And so each of the clinics in our network employs community health workers with histories of incarceration, with that lived experience of incarceration, to support community members with their behavioral and physical health needs. So all of the clinics that are in this national network have behavioral health that's integrated into primary care. So that means that there's primary care providers that prescribe medications for opioid use disorder. There's treatment for mental health conditions, and so on. So, and this model of care was first developed in San Francisco through input with folks in the community impacted by the carceral system. And since 2010, we have been supporting health systems nationally to implement this model. And now we have over 40 sites in 10 states in Puerto Rico implementing the model. And this is an evidence-based model of care. So we know from rigorous research that it reduces emergency department visits by half. It also reduces reincarceration for folks due to reductions in parole and probation violations. And as a result, folks spend 25 days less incarcerated over the period of a year than people who are not in the program. You can go to the next slide. And so here in California, we've supported 21 health systems in 14 counties across the state to implement this model of care. You can see in the map which counties we're in. And something that's really unique to California is that we've actually developed a reentry healthcare hub here. So during COVID-19, we just really saw a need for our sites to come together to serve as a safety net for people coming home from prison. And this is because, even before COVID, the time before release, the time right after release is just a high risk period for folks from a health perspective. So studies were already showing that, people are 12 times more likely to die in the first 2 weeks coming out. And with COVID, the health system was under so much pressure. There's thousands of early releases happening. So all these things together, I think we saw were just exacerbating the gaps between the systems. So between the prison system, between the community health system. So we really wanted to step in and fill those gaps that we saw. So we created the California Reentry Healthcare Hub. And there's two main pieces to this. One is that we set up a care coordination system that is used by nurses in CDCR to refer patients so that, and this is patients who both are looking to receive medications for opioid use disorder and or primary care out in the community. So far, we've had over 4,000 referrals through that system. And actually of those, a third are actually folks that do need medications for opioid use disorder. So a lot of folks with behavioral health needs. And then the second piece is our community health workers started a hotline for people that are either currently incarcerated or those who are in the community to help them get connected to healthcare. And this is staffed by community health workers that work in TCN programs across the state. And so far, we've gotten over 900 calls to that hotline. And both of these systems, what they really do is just help folks make those connections to healthcare in the community. So we can go to the next slide. So now I just want to talk a little bit more about the work that's been supported specifically by CCJBH. So as a whole, the focus of the project is just to make sure that our network of TCN sites are fully equipped to serve patients who have behavioral health needs that are returning from incarceration. And, on this slide, you'll see we're really highlighting some of the activities that we had that were focused on assessing needs and just further planning for the project. So one key activity is we established a site advisory group that is comprised of community health workers with histories of incarceration and other staff at TCN sites. And they've just been providing input throughout the whole project. We consulted with this group to prioritize training needs for community health workers and plan out our trainings accordingly. We also interviewed patients at TCN sites to just understand better the barriers and facilitators that they were experiencing to receiving behavioral health care. And, and lastly, in terms of this planning, we've used this input from the interviews, the site advisory group to create interview guides that we're using to create testimonial videos that, and then will in turn will be used to train providers about the needs of this population. So you can go to the next slide. So just also wanted to highlight, we've also completed a lot of training and mentorship activities for TCN CHWs. So these include fireside chats, which are group mentoring sessions, workshops on behavioral health topics such as suicide assessment, also continuing medical education training for providers on supporting patients who have behavioral health needs. And, also really critically, this kind of goes back to the hub I was describing at the beginning. We worked to just better organize our statewide network to respond to patients, including those with behavioral health needs. So to do this, we've developed workflows with all of the sites in our network so that patients who are referred to us by CDCR nurses and those who call the hotline can get connected really smoothly to TCN sites that can meet their needs. We've also held network coordination meetings to ask for input to make sure these referral processes are working and to just share statewide policy updates like CalAIM, and also hosted training and coordination calls with CHWs that are staffing the hotline. So now I want to turn over the conversation to Jonathan Chu, who again is our Reentry Healthcare Hotline Coordinator. And he's going to share some examples of how these coordination activities have really helped lead to successes for patients that are returning home from state prison.
There are 3 minutes left.
Thank you, Liz. Hello, everybody. My name is Jonathan Chu. I'm formerly incarcerated. I served 17 years inside CDCR, and I am the TCN Reentry Healthline Coordinator. I just want to give some examples about what our hotline does. As Liz has said, our hub consists of 2 parts. One is the referral system that CDCR is able to contact us and submit referrals for patients while they're still incarcerated. Our hotline side deals directly for the people that's currently incarcerated and those who are formerly incarcerated so that they can speak to somebody. They can speak to our CHWs and they can get referred to either the place in their county or to a different county. So, some of the calls that we get calls from inside, as I've said, and, one of the calls that we've actually gotten was a person who's about to be released in about 28 days. They were going to be in transient and they are currently on MOUDs and, they are looking for information and they want to get a connection. So our job is to help them to get assistance. And what we did was we were contacting nonprofits out in the community and see what we can do about his housing. We contacted CDCR, the prison itself, to find out if there is a referral and what we can do to help him have a transition coming back in the community. We've also had callers who were formerly incarcerated, who actually was released on Veterans Day. This person came out of CIW. She had contracted COVID while inside and released back out to the community. Unfortunately, her Medi-Cal was not set up and she had been going to urgent care for all her medical needs. and she contacted our hotline. And for us, we were able to get her connected to our CHW in Los Angeles, get her seen and get her set up with primary care, therefore not having her to go to urgent care every time that she was lacking her because she ran out of medication. We've also were able to deal with people who are currently on MOUDs or who want to be connected to MOUD. We've had a caller who was in Orange County. He was off of MOUD prior to release. He came back out to the community and he wanted to get back on. He called our hotline and we were able to connect him to our CHW in Orange County.
30 seconds left.
And getting connected. So yeah, those are the things that we do offer our hotline to be able to assist people who are currently and formerly incarcerated. Liz?
Great, and you can go to the last slide. Yeah, so just to wrap up, so for next year, we have, more training, mentorship, and network activities ahead. We're also going to finish up our testimonial videos and discussion guide and start getting those out through screenings to providers, and also some training summits for both the community health workers with lived experience in our network and program staff. And I know we're out of time, so I will go ahead and pass this over to Joseph Gray, who I know is the LEP lead for ARC. So thanks so much, everybody.
Thank you so much, Liz and Jonathan. I really enjoyed hearing you guys' presentation. I wish that we had time to get into your last slide, but I'm sure we'll hear more about it later. Thank you for the introduction. Also, my name is Joseph Gray. I'm the Regional Director for the Anti-Recidivism Coalition here in Sacramento. I'm super excited to tell you guys a little bit about what we're doing within our project here in Sacramento. We could go ahead and go to the next slide. So for the outline of my presentation today, I'm going to start off by giving a little bit of a background of ARC, and then I'll go into some of the project highlights that we have that are going on in 2021. And I'll get into some of the things that we plan on doing for the next upcoming year. And Q&A will be saved till the end. All right, so a little bit of background about ARC. ARC is a relatively young organization still. We were just founded in 2013. And the way that we were founded is an interesting story in itself. Our founder is a gentleman by the name of Scott Budnick. He's actually a pretty well-known movie producer. He produced the Hangover series. People always get a kick out of that when I tell them who our founder is. But the way he got involved in criminal justice work is that he was doing some, I guess, like mentoring or some visiting within juvenile hall, one of the juvenile halls in Southern California. And he's talking to one of the young men there. He's a 14-year-old male, Latino male. And he, was just talking to him to ask him how long he was going to be in there for. And the gentleman told him, the young man told him, like, oh, I'm never coming home. And he's like, what do you mean? Like, how long is your sentence? And the young man said, well, I got sentenced to like something close to 200 years. And Scott was just baffled. And he was like, wow, like, I've never even heard of that before. Like, what did you do? How many people did you kill? Was it like a school shooting or something like this? And he was like, no, I didn't do anything. I didn't pull any trigger. I didn't harm anybody. I didn't touch anybody. I was just in the wrong place when something happened. I didn't know it was going to happen. I just happened to be in the wrong place. And, they threw me in there. And with that, Scott was just super motivated to start something that really started to change the way that our justice system works here in California. So that's how ARC was started. It started off as kind of a peer support network, really just annual retreats. So once a year, people would get together, go on this camping trip, and it would be life-changing. But it started off really small, and you can see from this picture, this is our last one. This isn't even everybody, but it's gotten really large. And of course, our services have expanded to be comprehensive of a lot more things. And so you'll see more about that on the following slide. So here are the services that we offer in Sacramento. I'm gonna just touch on a few of them really quickly. Starting with policy advocacy, that's how ARC is identified really across the state. Excuse me, by our policy efforts. To this point, we have changed over 33 laws statewide. They have been implemented and put into effect. having to do with criminal justice. The laws that we have passed have impacted over 50,000 people throughout the state of California. We also have workforce education department, which helps people get connected to schooling, higher education, and also get connected to employment. We support with housing. We support with, we go into different facilities throughout the state and do mentoring in different facilities. And then of course, all of the reentry services as far as counseling, life coaching, case management, financial literacy, all of these things and classes that we offer. So this actually brochure that you're seeing right now was funded by this project. We utilize this to get this information out to as many people as we can, both within the facilities and individuals that are returning home, just so that we can continue to support and impact as many people as possible. We'll go to the next slide, please. One of the projects also that was supported by the LEP project is our Fair Chance Hiring Campaign. What our Fair Chance Hiring Campaign is this campaign that ARC put on to inform organizations and businesses and entities about the Fair Chance Hiring Act. The Fair Chance Hiring Act went into effect in the year 2018, but not a lot of people know about it still. So what the goal of this project was to inform different organizations and people about the Fair Chance Hiring Act and tell them the benefits of why it would be good to give a chance and give opportunities to individuals who are system impacted or formerly incarcerated. So we held a series of meetings and seminars and just events to help educate people about the Fair Chance Hiring Act and the benefits of hiring individuals that are formerly incarcerated. We'll go to the next slide, please. One of the other projects which was supported by LEP was the SB 823 implementation. What this is SB 823 is the bill that was passed that's pretty much closing DJJ and bringing individuals, young people that were within the Division of Juvenile Justice System back to their counties. And so in Sacramento, ARC is one of the lead organizations on the subcommittee that is supporting the implementation of this bill. And of course, we utilize lived experience. Me, myself, my lived experience comes from the juvenile justice system within Sacramento County. I spent 3 years also under the supervision of Sacramento County Probation. And we utilize our members who would like to tell their stories and utilize their experience to help direct and impact the implementation of this bill that's bringing all these young people home from DJJ. And the way that it's supported is we also compensate everybody for their time and for their experience and for their contributions. Next slide, please. Other highlights from this past year are our policy and advocacy training. So we provide opportunities weekly for our members who are all formerly incarcerated, system impacted, to attend policy and advocacy trainings to learn how to go about advocating within the Capitol. Not only that, but we also provide opportunities for when we have legislative visits for our members to join us in the Capitol, speaking with these legislators to share their experience about how they were impacted and just kind of, thank you, and just kind of help change the stigma of individuals that are formerly incarcerated. Also, this LEP project supports our workforce coordinator who helps to create jobs for individuals that are formerly incarcerated and system impacted, and also helps to get them connected with those jobs and provide trainings and coaching to make sure that everybody is equipped for those opportunities when they come up. And let's see, let's go to the next one. All right, so what we have coming up for this year, we have our annual retreat, which we're gonna have hundreds of members. It's kind of that first picture that you saw. We're gonna have that where we have hundreds of members come together and have a lot of different groups and webinars and fun. We also have our Fair Access Education Campaign, similar to the Fair Chance Hiring Campaign, except this time we're going to be addressing the different sectors that at this point don't allow individuals that are formerly incarcerated to even enter like the medical field and different fields like that, which have barriers to, individuals who are system impacted even applying. We're going to be addressing some of those sectors to try to open up more opportunities for individuals who are formerly incarcerated. A social media toolkit, I'm not going to get too much into that, but one of the things I'm really excited about is having a lived experience career fair where individuals who are formerly incarcerated will be able to be hired on the spot, because we're going to have over 30 different jobs there present, looking and agreeing to hiring individuals who are formerly incarcerated. And I think that's the last slide. All right, made it just in time. If you would like to reach out, here's some information here that you could reach me. I would love to talk to any of you guys. And I am now going to pass it over to Tiffany Carter from Cal Voices. So thank you guys for your time.
Thank you so much, Joseph. Can you all hear me okay? Awesome. I just want to first and foremost say I'm such a fan of our lived experience projects and TCN, ARC, wonderful presentation. Thank you so much. I am going to go ahead and get started. Welcome to the Access California Cal Voices, Southern and Superior Region Lived Experience Project presentation. My name is Tiffany Carter. I am the statewide advocacy liaison with this organization. And so happy to be here and present on our status thus far with this contract. Unfortunately, our Director of Advocacy, Andrea Crook, is unable to be here, but is here in spirit. So we'll go ahead and advance to the next slide, please. So up next, I'm just going to do some brief introductions of who our organization is, Cal Voices, and our program, Access California. Then I'm going to provide an overview of our highlights for the Southern and Superior Region activities, and then what's on the horizon. Next slide, please. So Cal Voices is our organization, and I have to say that we are 75 years young, as our Director of Advocacy says. We're the oldest peer-run organization in California. And we're really dedicated to improving the lives of the residents throughout our diverse communities here in California through advocacy, education, research, and culturally relevant services. So in all of our programs, we work with individuals and families with mental health challenges to promote that wellness and recovery, prevention, and improved access to services and support. Our team strives to provide peer services that foster recovery, that reduce that stigma and discrimination, and improve cultural humility through a variety of ways, such as self-help, education, and culturally relevant research. Next slide, please. All right, so what does ACCESS stand for? It is a mouthful, which is why we say ACCESS, but it stands for Advancing Client and Community Empowerment Through Sustainable Solutions. And I want to focus on the empowerment through sustainable solutions, because that's truly who we are. And our mission ultimately is to strengthen and expand local and statewide client stakeholder advocacy in California's public mental health system through individual and community empowerment. And we do this in a variety of ways, right? Through research, data collection, evaluation, education, legislative and policy analysis, training, outreach, engagement activities, you name it. ACCESS really tries to implement strategies to elevate the voices, identify the needs, and increase genuine public participation in client stakeholders to drive that truly transformative change in California's public mental health system. Our goal ultimately really is if ACCESS is to go away, we want people to have the tools and the skills to be able to continue this work on, build upon it, and expand it. Next slide, please. So some of our values, not limited to, but our advocacy, recovery, and peer support. And just to give you a brief example of what I mean by advocacy, it's that meaningful stakeholder participation and that active solicitation of community feedback and that expanded opportunities for involvement. Recovery, we're talking about the infusion of the recovery principles in all aspects of services, recovery-based trainings and supports for mental health professionals. And lastly, but definitely not least, peer support. We are really sticking to the fidelity of the evidence-based model and the incorporation and expansion of peer support in all mental health programs, including the living wages and ongoing professional development and opportunity for career advancement in the peer support field. Next slide, please. So I gave you a bit of an overview of who Access is, which is this first bullet, so I'm not going to go over that. But Access and CCJBH, really our work with CCJBH is focusing on executing activities that aid the reduction of youth and adults with behavioral health needs and their involvement in the criminal justice, juvenile justice systems. So this is a really unique opportunity and groundbreaking opportunity to focus MHSA stakeholder funds on justice-involved population. And I have to say, we're just beyond enthused about being with CCJBH. It's a really exciting project right now that we're able to work on. Next slide, please. All right, so some of the highlights that I'm going to just briefly go over are ambassador recruitment bootcamp. I'm going to give you some information about who the ambassadors are in our program. Ongoing community activation and advisory meetings, community needs assessment development, leadership roundtables, 6 of them that we've done, 6 stakeholder focus groups that we've done, 2 peer-run organization focus groups, and our stakeholder survey strategies meeting. And we'll go to the next slide so I can dig kind of into it. Awesome. All right, so our Access ambassadors, I'm not going to bore you all with reading this verbatim, but it's definitely got great information. And the ambassadors truly are the heartbeat of our program. And we have a very extensive application process that we have for individuals that want to be regional representation, and they identify as mental health client consumers with lived experience of criminal justice who participate in a variety of subject matter expert activities throughout this program. And these regional Access ambassadors, they provide us with insight and guidance on mental health and criminal justice involvement policy matters. They attend our sponsored trainings. They also do state level events and perform local level outreach, engagement, and advocacy in their home communities. They really ultimately, they're helping us expand mental health advocacy throughout the state by recruiting and networking with other community members and stakeholders. They're helping us establish and strengthen that local network and increasing stakeholder participation in the community program planning process, a key process with a lot of MHSA funds, and ensuring that county mental health systems incorporate the client and consumer voice and choice in local policy planning, programming, decisions, and service delivery. Next slide, please. So this is a really just fun thing that we wanted to just expand upon. We have what's called Bootcamp for our ambassadors. It's a week-long training, and it's on the MHSA, the Mental Health Services Act. With that, we talk about the history of the MHSA, the funding components, with an emphasis on the CPP, the community program planning process. Additionally, we talk about local and state level advocacy, how to go about doing that, how to craft your public comment, your public statement, criminal justice and behavioral health world, and community engagement. So this particular boot camp, we call them our boots on the ground. So they're referred to as troops throughout our boot camp. And as you see, they represent higher ideals and shared vision, protect the rights of others. And we're going to go ahead and go to the next slide then. Thank you. We have ongoing meetings with our ambassadors. We have quarterly ones called the Community Activation Advisory Meetings. And this is really where we discuss policy briefings and updates and provide them with tips and resources on how to enhance that local activation. We actually just increased this from quarterly to monthly because our ambassadors said that they could really just use that extra support, which is awesome. I think definitely given the state of the world right now with being virtual. Additionally, our ambassadors execute a variety of activities. One of them are the community network activities where they actually network with their community members and really empower them to understand the law and what are some of the trends in their communities and how they can go about advocating and what's expected of their public mental health system, things of that nature. Next slide, please. Our leadership roundtables, we did conduct 6 of our leadership roundtables, and we had them both in the Southern and the Superior region. This gave us an opportunity to really provide people with the space and the safe space to provide insight on what's going on in their regions and their counties. I do believe that we had 7 counties for both the Southern and the Superior region for this, with 45 participants in the Southern region and 40 participants in the Superior. Next slide, please. Stakeholder focus groups, we had 6 of these as well, so really encouraged our stakeholders to come and provide their insights on their experiences in the criminal justice system. What are some of the barriers, coming up with creative solutions, things like that. Additionally, we had, I believe, 6 counties for the Southern region and 10 for the Superior region. So it was a wonderful, wonderful show out. I'm going to speak to just very briefly as well here. We also had the 2 peer-run organization or peer provider focus groups. And we had our stakeholder survey strategies meeting, which was an opportunity for our subject matter experts to advise us on what are some of the data collection points that aren't collected currently, or they don't see, or that are really valuable in some of the services that they've been provided or haven't been provided, that we could try to really capture throughout the state. So they gave us great insight on some really amazing questions to ask. Some are a little bit hard to ask people, but definitely wanting to capture data points that are going to help us improve the system and help us be able to provide recommendations to CCJBH for advocacy, policy, systems change, and really transforming the public mental health system. Next slide, please. All right, so these are just our upcoming events at a glance. We have our community activation workshop. That's our first one's going to happen in March. Our cross collaboration workshop again in March. Our peer provider is going to be in April. And then our second ambassador training, which is really just revving them back up, giving them some good tools, and then additionally recruiting some more people, because with COVID, unfortunately, life has happened. And so we've had to definitely be flexible, and we allow people the opportunity to come and go as they need to, really take care of themselves. Recovery is at the one of the main focuses of this particular project. So we're always recruiting new advocates and wanting to really touch a lot of the communities that haven't had an opportunity to have that representation. So we'll have another training. Then we're going to have the Voices of Opportunity video campaign that's going to happen as well, where we're going to highlight individuals with lived experience to be able to share some of their journey, provide insight on their advocacy efforts, and really just. Okay, perfect. Thank you. And then our priority populations and approaches podcast that's going to happen in late next year. Currently, right now, we have our stakeholder and leadership survey that's running through February of 2022. So if you see that pop up in your inbox, please, please, please take it, share it far and wide. We definitely want to capture as many voices as possible and get as much experience collected so that we can really share value and uplift the experiences that people are having, and we can start changing some of the behavioral health and criminal justice activities and resources that are available. I do believe that's the last slide. All right. Here's all of our contact information. Again, my name is Tiffany Carter. Thank you so much for this time. So grateful to be here. I'm going to hand it off to Juliana with LARP to go ahead and share theirs. Thank you so much.
Thank you so much, and everybody that's presented. It's really exciting hearing all the amazing work that you all are doing. Here we have the Los Angeles Regional Reentry Partnership, Leaders Training Academy, another acronym for all you all. It's leading, engaging, advocating, demonstrating, enhancing, and expanding reentry systems. And for short, we just call it Leaders. Next slide. So today we'll be going through an outline of what we'll be presenting today in terms of history, mission, vision, LARP network, overview of the Leaders Training Academy, highlights of 2021 and 2022, and some questions towards the end. I'm Juliana Mendez. Most recently, I'm now the Director of Programs and Operations, and I'll be presenting with my colleague here.
Hi, I'm Anthony Garcia. I'm the Program Coordinator. I oversee the Leadership Training Academy.
Next slide, please. So LARP, just a brief history about LARP. LARP was founded because we realized because of the passing of AB 109. So because we realized the change of people serving their sentences locally have been released. Changing their sentences from state to locally. We have been they're going to be released locally. So we were in need of a reentry network to help those individuals. So we asked around and there was no network. So we figured if folks were going to come home and they were going to be served locally, we need to be there for them. So because we are a network of service providers, advocates, impacted individuals, and their families, we knew that there were gaps in the system. So really we were on the ground telling the county about what communities were being served and what communities were not being served. And so through that, LARP really has played the role of implementation. So we know that a lot of people can pass new laws and pass new ballots, but we quickly realized that if there aren't individuals in the community thinking about implementing the laws, then it becomes a waste. So that's really what we consider our specialty. But here's a bunch of like fun facts of history there. But next slide. So really our mission and vision is we host a dedicated reentry space for reentry professionals and impacted individuals. We prioritize advanced evidence-based practices for reentry service delivery, and we also identify any policy. We're really birthed on the social determinants of health model, where we make sure we have committees of education, employment, integrated health, policy and legal, faith-based committees, as well as the services that we offer our systems by helping build systems within LA County, as well as providing like space and feedback space for agencies to come and give us feedback about the services that they're receiving, as well as policy, implementing policy and trying to change policy on a bigger level within county and statewide, as well as capacity. So being able to provide capacity to organizations either through connecting them to grant funding or providing capacity workshops. A fun fact about LARP, I would say, is that we are celebrating 10 years today. So that may seem like a baby to other people, but we're very excited that we've been here for 10 years. And another fun fact is that we're the only network, the only county-wide network reentry focused on reentry professionals and individuals and families. Next slide, please. So this is our organizational chart. You could see our staff is small but mighty. We have our steering committee and our executive committee that really drives our network. And so what we really pride ourselves in saying is that LARP is for the people. So we don't own LARP, but the people own LARP. So our network is really composed of a bunch of reentry professionals and reentry organizations. So we have ARC that's on our board, as well as Amity Foundation, and then as well as regional approach, we have Paving the Way Foundation in Antelope Valley. We have Center for Living and Learning in the Valley. And so those are a lot of options in terms of how vast our network goes, from employment agencies to housing agencies. We have our regional committee. Our regional approach is as well with like Los Angeles, Antelope Valley, Pomona, West Los Angeles, and Long Beach. And through that, we drive our work through our committees. So through our employment, education, integrated health committee. And underneath that, also in our network, is our leaders. So we'll be presenting about our leaders, and hopefully you'll get to see a video about them. But that's really what it is just empowering individuals that are already leaders in their community and just giving them the tools. Next slide.
Hi, everybody. So this is where I come in and I explain to everybody what the Leadership Training Academy is about. So these are a couple of highlights about what the Leadership Training Academy consists of. We've broken down into 4 sections, which is capacity building, outreach and engagement, education, and awareness. Like Juliana mentioned, that our intention is to help and assist our leaders that are currently leaders in our community and enhance and elevate their skills to become more effective leaders as they are either in transition or already making an impact in our community. Next slide, please. So this is a quick breakdown and overview of what the Leadership Training Academy consists of. Just to touch on a few, there's one that's very important that consists of like the bread and butter of this, which is the training section. The training section comprised of different trainings that we help provide the leaders put them through. Some of those trainings consist of public speaking, trauma-informed care, social determinants of health, and policy. Another component that is very important to this is the family component. We encourage the leaders to invite family and participate in some of these trainings, such as the social determinants of health and a COVID-19 town hall that we assisted in hosting and collaborating with the Leadership Training Academy. Another component is social media. We've been utilizing social media as a tool to bring more awareness and reduce stigma, specifically with mental health. So we've been actively in our social media platforms, along with the leaders' help, to make sure that we bring more awareness to that. And another very important piece that we take pride in is the community-based research section, where we partner with the leaders, and they actually hosted focus groups to focus on, to help identify challenges and barriers that currently exist in the system, both in incarcerated and in the reentry systems. Next slide, please. Next slide, please. So the Leadership Training Academy consists of, it was broken down into 3 teams. The 3 teams focus on employment, education, and integrated health. We are currently in cohort number 2, and we are proud to say that the cohort number 1 leaders that completed the program are now in transition into an alumni, where they serve as mentors to the new cohort, which is cohort number 2. So we call upon them to help either to do community engagement events or whatever it may be, but they're actively involved in the next cohort number 2. I believe we're going to go into the video section, correct?
Yes.
Yes, let me bring that up.
Okay, thank you.
Thank you, Paige. So just to give preference, or while it's being brought up, so this is a video that we presented to the leaders at the graduation. So we'll be able to show you all like in action of what actually occurred in the Leaders Training Academy, because we recorded all of our meetings and since it was all virtual.
Can you see my screen okay?
Yes, I'm just not sure of sound. I don't think we can. Oh, we can hear the sound a little bit.
Paige, I think you might have to share sound from your video. It's not just we still can't hear the sound.
It's just typing right now. It's typing sounds. You can't hear it.
Okay. No, not really, but.
There you go.
There you go. Okay, it was there. Yeah, I don't think we're here. Oh, here we go.
Thank you. Can you go back to the slides, please?
Yes, let me bring that up. Can you see my screen okay?
Yes.
Oh, next slide, please.
Sorry, there's a bit of a lag. Whoops. There we go.
Thank you. So just to continue, that was a brief little video of our graduating cohort number 1 leaders that actually successfully completed the program. And just to touch on another 2 components that I haven't touched on, capacity building. So capacity building consists of everything from public speaking, policy 101 training, social determinants of health, trauma-informed care, and then County Measure J committee meetings that took place. Within that, we've had the privilege such as collaborating with Cal State LA to work together and actually bring about stories in the forefront that would make an impact in the community, bring more awareness of the needs that need to be met through testimonial recordings and providing capacity to do that effectively. We also provided a women empowerment piece where the women had a chance to touch on the impacts that COVID-19 had in the women's incarcerated system while they were incarcerated, transitioning back out to society. The other section was outreach and engagement. So through outreach and engagement, we actually assisted, we collaborated with the leaders and with one of our integrated health chairs to actually run a community engagement virtual town hall that educated the community about COVID-19 and the risks that come with that, with the virus that's going around. Another event that we're very prideful of being a part of with Cal State LA was the Public Memory Project, which is a historical archive that's on living, where the lived experience population can contribute testimonial or any type of history that they would like to provide. So that way their art, their poems, their poetry, their stories will always be in the Cal State LA library. Next slide, please.
So here we also, part of the education portion, we encourage leaders to come up with priorities that they wanted to see change within either programmatically or policy. So one of the priorities was for the integrated health team was expanding and distributing information among the currently incarcerated and also formerly incarcerated individuals about COVID-19. So with that, we were able to have a town hall. And so then as well for education, we were able to connect the leaders with a regional coordinator regarding rising scholars. And for employment, documenting, one of their priorities was about documenting and making sure people were released with their documentations. And with that, we were able to co-sponsor a bill with many others that are on this call regarding being released with documentation. In terms of awareness as well, we were able to promote this on our newsletter, promote it to different news outlets about the success that leaders are having. We have some leaders that applied to law school, other leaders are getting their PhD and getting jobs as well. Next slide, and as we wrap it up, because I know we're running out of time, quickly here, so some of the 2022 activities, we're excited to be offering life coaching, financial workshops, a variety of more in-depth policy workshops, social media, bringing social media awareness and hashtags and more information on them, as well as Anthony mentioned the Historical Women Project, expanding on that as well. And those are some of our 2022 activities. And I'll hand it over to Brenda for questions. Thank you.
And I think actually we're gonna just hold on questions for just a hot minute so we can finish through our presentations. I think actually, because we're gonna just try to keep on track. So let's go ahead and move to our lived experience project with the California State University of Sacramento. I guess before I move on to that, thank you so much for our regional lived experience providers. Just again, wonderful work that you're doing, and it's great to have you guys provide these updates in such a very powerful way, so that everybody who's tuning in today and all our council members can really get a good understanding of all of this wonderful work that you're doing. All right, so moving along to our California State University Sacramento project. So in addition to the regional lived experience projects, which are really great for building local advocacy and informing the work we're doing here at CCJBH at the state level, we also have California State University of Sacramento, who's been helping us look at a couple different projects. They've helped us develop the proposal that became the regional lived experience contracts, and then also it spun off into some additional work. Their contract has spun off into some additional work looking at hiring individuals with lived experience into the criminal justice and behavioral health sectors. So without further ado, Alex Cole-Weiss will walk you through it. So welcome, Alex.
Thank you, Brenda. Good afternoon, counselors. And oh my gosh, I'm just so grateful and honored to hear all the updates from the LEP contractors on the ground. Like Brenda said, we started this partnership with CCJBH before those contractors were in place, really playing a really interesting role in supporting the development of that program. And I just kudos to all of you for all that great work that you're doing. And it's really neat to hear some of the linkages with what you're doing on the ground and some of the work that we've continued to do and support CCJBH on. I apologize, I'm Alex Cole-Weiss. I'm a lead facilitator and mediator here at the Consensus and Collaboration Program. I'm joined at this meeting by Ori Coleman, who's a senior with us, and my other colleague, Julia Van Horn, who's also a lead. We've been working on this together. I'm in charge of doing the presentation, and they will jump in if I miss anything. So let's get right into it. Next slide, please. So we're going to do a quick background on our program, help you understand a little bit about our role. We did go before the council, I believe, in late 2019. So we've seen some of you before. Brenda was a counselor at that time, which is kind of neat. So we've been here before, so you may have heard some of this information, but it's been a while. So we'll talk about our engagement toolbox, talk about project highlights over the last 2 years or so, and then look ahead to 2022. So next slide. So we're a little bit different, of course, than some of the other on-the-ground folks and the expertise that they have. We are the Consensus and Collaboration Program, or CCP, and we date back to 1992. And really, our mission is to build the capacity of government agencies, stakeholder groups, and the public to use collaborative strategies to improve policy outcomes. Next slide. We support community and public agency long-range strategic planning and visioning, multi-party consensus building, facilitation, negotiation, and dispute resolution, and inclusive and participatory public participation processes on emerging and controversial policy issues. So what does that mean about our role on this project? Next slide. We're really here to help design and support stakeholder engagement opportunities to identify issues and inform potential efforts that are needed to support individuals with lived experience in their networks at that intersection of the criminal justice and behavioral health system. So we really help to bring people together to inform and answer some key policy questions, programmatic questions at times. Next slide, excuse me. So we have a pretty hefty engagement toolbox. When we met with you last, we had done quite a bit of work on the left side of this slide from our kickoff event, our advisory group that we formed. We had done kid informant interviews, regional convenings, listening sessions, literature review, survey, virtual workshops. And of course, we always seek to publicly share outcomes, sometimes in reports and other ways, but we've used all of these tools in our toolbox over the last 2 years. And I'm sure that there are more that we could bring into the mix moving forward. Next slide. So 2019 was our phase 1. I'll talk about these a little bit more in detail, that really focused on that bringing people together around the stakeholder advocacy contracts. After we had completed that, that's when the lived experience projects regional contracts were awarded. Phase 2 started in 2020, and then phase 2A was in 2020, and then phase 2B was in 2021 that we're wrapping up. Next slide. And I should say, sorry, all of this work is really advancing the conversation on lived experience, which is right up there at the top, really building on this iterative work that we're doing with CCJBH and other partners. Next slide. So when we started this project, we were really focused on bringing people together to answer that question right there. How can we support stakeholder advocacy to reduce involvement in the criminal justice system for individuals experiencing behavioral health issues? We used a whole bunch of tools that I went over a minute ago. We reported back to the council on some of the amazing lessons we were learning, especially out of the population-specific listening sessions, small conversations with folks really speaking to their struggles and their needs. We engaged over 250 folks in that work that we did. And what I really want to raise up is, these takeaways on the right side are really reflected in the on-the-ground work that all of those LEP contractors are doing. They are this is what we learned. And so we can look back on that learning and see that the folks who are doing the work on the ground are providing training and education opportunities. They're building organizational capacity and partnerships, promoting common language and cultural competency. And then I'm sure there are more details here, but looking at blending funding streams to support individuals with lived experience. So I saw all of those things, which is really rewarding to see and not surprising because, we did this to inform the work, and these folks who did it on the ground are really, really experts in that. Next slide. So moving into phase 2, one of the things that we wanted to advance the conversation on was about employment, and specifically, how do we effectively advance the employment of individuals with lived experience in the criminal justice and behavioral health fields. And one of the second phase of this project was a workshop where we talked about some of the barriers, and it really stuck with me. One of our participants, our key panelists, said, it's in the very, for people who are peers and peer support, it's exactly the experience that makes us good peers and able to provide support to people. It's exactly the experience that disqualifies us from the criminal justice and behavioral health fields. It's that double-edged sword that, it's just right at the root of the problem. So we tackled this by engaging folks in the CCJBH network through an online survey and key informant interviews. We had over 153 respondents and 10 organizations involved. And we really took away from that some of these key barriers and really trying to think about how to leverage existing practices to address them. So background checks, equal opportunity laws and disclosures, funding and billing, fair compensation, stigma, let's just say lack of recognition, and then a lack of, currently the peer support specialist certification, advancement opportunities, and insufficient membership. Next slide. So after we did that work to, kind of more individual and then with a survey, we really wanted to take that into next steps and talk about solutions to these barriers. And so we did a workshop. I think that John, one of our presenters, was there, which is exciting. So how can we implement solutions that overcome these barriers to individuals with lived experience getting hired in the criminal justice and behavioral health fields? So we engaged over about 100 participants in that workshop. And we are still working on the outcomes of that in a report that's forthcoming. But really some of those key takeaways to elevate those promising practices on the ground, continuing to do that on the ground work that people are doing. And then at the same time, really seeking opportunities for policy change. I heard it a little bit with the work that ARC does, but balancing both of those things and looking at changes at multiple levels. I'll just say real quickly here, I know we have a little bit more running up on time. One of the things that Mr. Joseph Gray said that the ARC is working on, both the Fair Chance hiring and the Fair Access education campaign. Those are some of the key things that I think came out of the conversations in this workshop, really highlighting that there are those barriers in some of the fields in criminal justice and behavioral health, whether that's in social work, barriers to access education for, that folks with histories of incarceration face. And so how do we, again, that folks who are most qualified to provide support and peer support through that lived experience are the ones who are disqualified because of that same experience. So on to the next slide. We're really pleased to have completed our report of the findings from the key informant interviews and the survey that we did about successful approaches to employing individuals with lived experience back into those fields I mentioned. And then our report on the solutions to hiring barriers is coming soon. Next slide. So looking ahead to calendar year 2022, we are really excited to be moving forward in the area of supporting CCJBH on the work they're doing for the Forensic Peer Support Specialist Certificate. That's upcoming. So really helping, we're going to do potentially some focus groups, some other stakeholder engagement activities to help CCJBH hear from folks on the ground and some of the key players working on that. And then the other one is about examining barriers to Medi-Cal services among individuals transitioning from incarceration. So that is still to be determined, but we look forward to ongoing partnership with both folks on the ground and of course with CCJBH. I know we're going to get Dick's side. We're going to get to questions. We'll just throw up that last slide, which is our contact information. And I would love if my colleagues, Julia and Reed, if there's anything that you want to raise up. I think we have just maybe like a minute or so left.
Thanks, Alex. I actually just one thing I want to highlight. Hello, everyone, and thanks for the opportunity to present Reed Kalman. One thing that just to highlight over this last few years that we've been working with staff that continue to come up is every time that we go out and ask a question and we get some answer, these answers spur new questions as to why and how. And we've kind of been evolving this conversation. And particularly with this last workshop around solution, one thing that I keep thinking about is that there, as was presented today, there are great local and regional work that is being done, a lot of experience, a lot of expertise, a lot of good work. And in my mind, the question that I keep coming back to is how do we scale these efforts up across the state? And I'm hoping that as you're doing your work, that you're continuously also thinking about that question, because the work that you're doing is so important for others to know about and hear about. And so the fact that you're doing that with your advocacy, with your outreach is particularly important. And if there is a way to elevate that to the council in a way that that knowledge can be disseminated, there is great value there. So wanting to highlight the potential value of the work in terms of expanding it and scaling it up statewide.
Great. Alex, are you ready for me to
Yes,
take over
please.
again?
Yeah, go for it.
Okay, no worries. And thank you so much for this presentation. I just think in reflecting on the presentation from both the regional lived experience contractors, so Transitions Clinic Network, Anti-Recidivism Coalition, Cal Voices, and the LA Regional Reentry Partnership. I mean, just and the CSUS team. It's like so much valuable work, and all of these efforts that you're doing. It's helping to strengthen our service delivery. So these projects are really really strengthening the way we provide services and engage our population, which, is such a key issue to making sure folks have access and want to receive these services. Building that lived experience advocacy capacity at the local level. Really, I know folks are showing up at meetings and really helping to shape some of those conversations. And that's helpful. And then also, even I can say from a CCJBH executive officer perspective, it's really helped with our projects. We've had our lived experience contractors helping with the SB 369 project, which I think was really a robust deliverable because of the work that happened either through your own feedback you gave from your own teams or from the focus groups, as well as some of the work that we've been doing with Public Health Meets Public Safety, trying to build out our data. You guys are working to help us with that. And some of those focus groups, also with some of the work that we're going to be doing with the employment and workforce development and the forensic peer support specialists. And then as well as all the help that we've gotten in terms of disseminating our events, even like our webinars. And we're seeing a lot more folks with lived experience showing up which I think is just a testament to the hard work and dedication to really lifting those voices up. So also want to say happy anniversary to the LARP team. Didn't know today's 10 years. That's pretty exciting. And also speaking of LARP, I had had the privilege and honor of being invited and joining the leadership, the Leaders Academy, both in the graduation and then the kickoff of the second cohort. And just want to say that, it was very inspiring, and it's great. I could see the growth that's happening, and then even that, like I saw what the presentations and the graduation, which were like, wow, oh my gosh, there's workforce right there. It's just so impressive. Some of the talent that our individuals with lived experience bring to the table, as well as seeing the excitement for the new cohort kicking off. And so I just wanted to say, in kind of in the spirit of that anniversary piece, that was one of my observations. And just really want to say that is the kind of work that our lived experience contractors are doing across the board, both with the regional and the Sac State. And all of this is just really helping to spread and strengthen the work that we're already doing. So with that, how about we open it up to our council members? This is these are your contractors doing your work for you. I just wanted to see if any of our council members have any questions. Paige, if you want to maybe bring the PowerPoint down just so we can see a little bit more faces on the screen. Thank you. If any of we'll open it up to council members for questions for our presenters today, or thoughts or reflections.
I have this. Brenda, can you hear me?
Can hear you, absolutely.
I can't see myself, so hold on just a second. So at any rate, usually with presentations, I take notes and I always write down some of the questions that I want to have. I didn't do that this time. So I want to thank all of the contractors, everybody that presented, because it was really well done and a lot of really good information. So I only have just kind of, I guess, one general question to everybody. And it may seem like a silly question, maybe even a dumb question, but it can be affirming for me to answer. And that is, with the work groups that we have with CCJBH, the one on diversion and reentry and the juvenile justice, I guess I want to affirm and make sure that representatives from these different organizations are regularly participating and joining us at our work group sessions. And so that's a general question, comment to all of you.
Yes, the answer would be yes. Our participants are participating in these work groups that CCJBH is having. Great question.
And that's you're from ARC, right, Mr. Gray?
Yes, sir. I'm from ARC, and I believe I can speak for most of the other contractors also, that their participants are also participating as well.
And I will say, sometimes I remember people coming on and commenting and saying that they're from ARC, but I just, again, want to affirm and invite, if there aren't representatives from each one of the contractors that are regularly attending and participating in both of those work groups, they're certainly welcome and needed. That input is very much needed. So I want to, again, just reiterate that invitation and hope everybody's involved with us at that level.
Thank you so much for that.
Absolutely.
Judge?
Yes, thank you. Again, thank you very much for your presentations. It's wonderful to hear the great work you're doing, and I encourage you to keep it up. I just had a couple of questions. The first one is this. Do you all make individuals who are mentally ill and caught up in our criminal justice system or leaving prisoner jails a priority in your work? Are they a substantial number of the individuals that you are offering training and assistance to, who hopefully will become peer navigators and be available to help others who are leaving prisoner jails in the future? are a substantial number of them individuals who have suffered from mental illness, been mentally ill themselves, and familiar with the challenges that mentally ill individuals have in coming into the community. That's my first question. The second one is, I noted in a number of your presentations references to CDCR, and I strongly support all the work you do in that area. But I would also like to know, are you making our local county jails a priority? Because we are now, through the courts, changes in statute and rules of our courts, releasing a very large number of individuals into the community prior to their cases being adjudicated. And for those who are mentally ill, they really need strong support on release. And I just wanted to make sure that you are focusing on all of our jails throughout the state. Thank you.
I could go ahead and speak for LARP in terms of making sure that individuals that are mentally ill are represented within our cohort. We do have an integrated health team. So how our process worked was we interviewed over I think this round was over 70 individuals, and we narrowed it down to 12. And the 12 individuals, out of the 12 individuals, 4 of them self-identified of that they are either on medication, going through, either have like multiple personality disorders. So we have those kind of situations where they're just like, I want to be able to be a leader in my community. And so that's something that we're helping them with. And so that's 4 of the individuals that are focused on that, and they represent our integrated health team. And as well as we, as a collective of the Leaders Training Academy, we are also working within our county jails to help close Men's Central Jail. And so that's some of the efforts that a lot of the leaders have been attending those meetings and being representative to that.
Thank you.
Yeah, and then for Transitions Clinic Network, yes to all of the above. So both the community health workers in our network that we're training, majority of them have some, history or primarily histories of mental health and or substance use disorder. Also, a majority of the patients they work with also have one or both of those conditions as well. And then in terms of the jail, we do train all the sites in our network and the community health workers in our network to connect with the jails in their local area. And actually most of the programs and the community health workers that we work with do have either some form of in-reach that they're doing to the jails or, on-site outreach. Also with our hotline, which Jonathan could speak to more, but we do also publicize that in jails, and it's the line that we have is set up to accept calls that come from jails as well.
Thanks. That's wonderful.
I'll go ahead and jump in for Cal Voices. I'd like to also acknowledge Mac's question. Yes, we are on your work groups regularly, and definitely inviting our ambassadors to consistently participate when they can as well, for sure, and expand it out to the communities that they represent and support. But sorry, I have a little one. But we also definitely our priority are individuals with lived experience for behavioral health and criminal justice. So all of our ambassadors have to have that expertise and lived experience in order to become an ambassador. Additionally, any of the activities that we do, that is our focus, is making sure that we're reaching out to that priority population and ensuring that that is the main focus of all of the activities. And of course, we want to nurture collaboration with community members and other leadership and family members, but really emphasizing that lived experience, both criminal justice and behavioral health. We don't necessarily require people to divulge their their experience, in detail. But the beautiful thing about this field and the individuals with lived experience is most people are willing to just voluntarily give that information because of that peer support, because of the evidence-based model, and how impactful forensic peer support can be, whether they're certified or not. They're all peer support specialists in essence, by just sharing their experiences. So that's, I won't take up much more time, but I did want to at least acknowledge that. Yes.
Thank you.
Great. Any other questions from our council members or reflections before we move on to public comment?
Actually, another question just popped
Oh,
into my mind.
Okay.
Am I limited to only one, or can I do
No,
more
you
than
can
one?
have as many as you want, Mac.
No, Anita has one. Anita has her hand up.
Anita's
Anita has,
yep, her too.
go, Anita. You go, Anita. You go.
Thank you. Can you hear me? Great,
Sure can.
thank you. I just wanted to know, I kind of come with the representing the peer on the family member side. And I wanted to know if any of your programs include family member specialists. I worked in several programs where we used peer support, and but that meant both on both sides. So I just wondered if any of your programs include family members as a staff.
I can speak for LARP. We do encourage our leaders to invite their families to certain trainings that we think would be beneficial, like a trauma-informed care training. We encourage them to have their family attend with them, as well as follow them through the process up until graduation. So we'll be able to have them attend that. But how we look at our programming is that the family is allowed to come at any point, or any peers that we encourage more the merrier, so that they could get part of the program as well.
Okay, thank you. And I just want to say that you're all doing fabulous work. I'm fairly new to this council. And I always say that the more work that's done at your level, they don't end up in the adult system. So thank you.
Mac, did you want to?
Just yes. And my second question is, again, to everybody, excuse me. I'd be curious if you could comment on if you have engagement relationships with local probation and or parole specifically in your collective efforts. And also, if you do, is it good? Is it bad? Would you like more? Would you like less? I'm curious about your relationship with those local, both the local and, again, the state parole agencies, given that a lot of you are focused on reentry and formerly incarcerated and individuals that are under some form of supervision. I'd love to know about that, the level and type of interaction. Is it a good thing? Is it a bad thing? Is it non-existent?
Well, for LARP, I would say it would be we're fortunate enough that we actually have a program. I'm not sure if you're familiar, but in LA County, we have the Doris Reentry Center. And so where it's service providers in the same office building as probation office. And so we are lucky enough to have our outreach and engagement coordinator in there. And so what we did is, with the probation office and with the community providers, we were able to provide a focus group, and used our leaders. And so we trained our leaders to be focus group and evaluation consultants. So they went into the probation office to assess the peers and to assess how the programs are doing, how are you receiving services, and the probation officers were very perceptive to that feedback. So we're lucky enough to have a good relationship there.
That sounds great, and I love your background. That is
Oh,
really
thank
pretty.
you.
They win the award for the best background today, no doubt.
Clearly.
Happy holidays, everyone.
Judge?
Yeah, I have one more question. Thank you. And it relates to CalAIM. Are you working directly at this time, any of you, with the managed care plans that will be implementing the CalAIM program? I'm particularly concerned because in my own county, I find there is very little input from outside into the managed care program that will be serving the vast majority of individuals on Medi-Cal coming out of our jails. And they, of course, under CalAIM, they will be responsible for doing the in-reach, providing peer navigators and so forth. And they will be an essential player unless they decide to turn it all over to the county, which of course, I presume is an option. But if the managed care plans move forward on doing this work themselves, I think it's really important that your organizations be involved in working with them, because I have noted that, and I can't speak for outside my own county, that there doesn't appear to me they have the knowledge base or the understanding that is really needed, and because they've never been doing things like this before in the past. It's not, it's not their fault. This is a new challenge for them. And I just wonder if you are working with them as well as all of the other governmental and nonprofit organizations that you have mentioned in your presentations.
Yeah, so I can speak for TCN on this one. So I'll say CalAIM has been one of the areas that we've been following extremely closely and weighing in on. So, just to mention, our executive director, Dr. Shir Shavid, is on the justice involved work group that the Department of Healthcare Services is running. And then also this isn't CalAIM, but I was just going to say there's also the CHW benefit work group that we have a member on as well. And we are engaging with managed care plans. There are many throughout the state, so we haven't spoken to all of them, but there's a handful that we've been, working with. We've been connecting the sites in our network to these plans. And, I think we're really looking to expand that to talk to more plans as well. I think one thing that makes it a little bit more difficult is that because this population, the reentry population, isn't for a whole nother year that they have to implement the enhanced care management program. Some of them are not able to prioritize working with that population yet. And we've been pushing them to do that, but yes, so we are in conversation and weighing in as much as we can.
Thank you. I really urge you to keep it up.
And I will say that, like, for me, because I'm on, I represent the council for DHCS's Behavioral Health Stakeholder Advisory Committee. I know a lot of our lived experience folks do join in on that as well, because I've seen them asking questions. So, so they are getting out there and helping inform those conversations. Okay, well, I'm doing a little quick time check. It's 3:35, so let's, if that's okay, we can switch over to some public comment. That was some great discussion with council members. I think we have one. Do we have any hands? Oh, Judge, your hand is still raised.
I'm sorry.
That's okay. We have
Stop
two
it.
folks who have hands raised in the chat. So Monica or Paige or Emily?
Yep, I'll go ahead and unmute
Okay,
Dale Arrington. Okay, Dale, you should be able to.
Yes, thank you. I want to thank Mr. Manley for asking the question about mental health support. And then I was also very pleased with the responses that people contributed. Thank you.
Thank you.
Okay, we have Stephen McNally. I'm going to go ahead and unmute you, Stephen. You'll have 3 minutes.
Hello, my name's Steve McNally, and I live in Orange County, California. My journey is, as a family journey, is mental health, mostly hospitalizations, less with the criminal justice. But I just love coming here because this is one of the few state or county meetings I go to where there's complete psychological safety for all participants, and membership is open and honest, and it's just okay, you know. No one's fearful of hiding the information. So I put in the, just directly to the panelists, I hadn't seen this before, and I'm going to follow up because I'm very interested in regionalizing this between LA, Orange County, Riverside, and San Bernardino. And for some reason, communications I get in mental health is part of our symptoms of being able to work together. But I also should say I am on a county appointed or vice chair of a county appointed mental health board, which, like most of the boards across the state, have really been marginalized to do its statutory duties. And I had the chair of the LA Mental Health Commission down in Orange County just on 2 days ago to look at one of our facilities. So, and the new incoming behavioral health director will be coming from San Bernardino. So I think there is an opportunity for us to regionalize some of the things, which will help us to get over the county politics that dominate us. I don't know about the other counties. I'm sure they dominate every county, but to some extreme, it's just much more difficult because we're graduate level in our particular county. So I want to focus on families and loved ones. That's what I loved about your presentation. The journeys are hard enough with not all families making it through intact, not all loved ones making it through alive, and certainly not making it to their best quality of care of life as quickly as they could, regardless of how much money we spend in California. It's the simple things and finding the people that will just talk honestly about what's going on. So like, and I'll leave it at that because I found that I'm a chatty Carlos and I'll go on and that's not my intention. So I just want to thank you all for what you do for families and loved ones. And I'm going to follow up with you guys to see if there's a regionalized approach. Thank you.
Thank you, Stephen. I appreciate you, participating in our meetings as well. Keeping the information networking. Looks like we have one more hand raised.
Yes, we have Cheryl Canson. I'm going to go ahead and unmute you, Cheryl. You have 3 minutes. Hi, Cheryl. You should be able to unmute yourself.
Oh, I wanted to say thank you. And I'm so grateful. I'm Cheryl Canson. I'm from San Diego. And I'm so grateful, and it strokes my heart to know that these conversations are being had and that people are starting to really focus on people who are mentally ill and are thrown in incarceration, in cages without expression and without impactful mental health treatment. I have a situation with my son, Jordan Jackson, who's in New Folsom, who has suffered a lot of traumas being incarcerated, being that he's mentally ill. Bipolar is his diagnosis. And I just want to know, I'm his advocate, have always been his mental health advocate and advocated for his mental health treatment during the schools, and now having to deal with it being incarcerated. I won't take my eyes off of him. I'll still be his advocate and still continue to be his voice. And want to know, what is the best route to get my son into from? I've seen him go to treatment from before, pre-conviction, but I want to know post-conviction, after he's already incarcerated and suffered severe traumatic situations from direct incarceration, like solitary confinement and beatings, and he retracted COVID. What is the best way, and who can help me get my son to recovery, to restoration and stabilization from his mental health into a state hospital?
This is Brent, and thank you, Ms. Canson, for sharing your situation and asking the question. Dr. Cooler, I didn't know if you wanted to talk a little bit about CalAIM Enhanced Care Management and how that's going to play out. And I think that's going to be one big beneficial new change in our system that'll be helpful for families and their loved ones. and I'm happy to chime in too, but I just,
Yeah,
since
please,
you're our
we can do-
JCS representative.
We can do that together. The improvements in the system will be to provide services while someone is still incarcerated and to build a better bridge. So when they exit, there's already a smooth on-ramp and continuity of support, and to not strand people as we have in the past. So significant changes, as the judge mentioned, the linkage to the managed care plans will be a new dance that we'll be doing together that will take some time to make sure that these handoffs and the coordination is done well. So I'm not sure that we can directly address the request that was just made, but in the future, I think we will have a better system to provide those services.
Thanks, Dr. Cooler. And Ms. Canson, I was thinking also we can follow up with you to provide you with some of the resources that we've been putting out from CCJBH that might help you link in with some of those conversations and help with that planning for how that system's going to build out to help folks like your son when he's transitioning out of CDCR. Okay. And it looks like, I thought I saw Stephen's hand go up for one second, and then it went down. But I did see one more open question in our Q&A, and it pertains to licensure for individuals who want to work in healthcare, but who had been previously incarcerated. That is something that did come up in our, excuse me, the work groups that this Sac State team was talking about in the presentations today. So that is something that came up as a barrier, and I don't have an answer for how to solve it, but it is something that is on our radar and thinking about that, and something to pursue as we kind of keep building off of that work. So appreciate you flagging it, because that is something that also did come up in our work groups. Okay. Anything else on that? Okay, well, I would just like to thank all of our lived experience contractors for the phenomenal work you're doing, and for coming here today and really just highlighting all the work you've done in the past year and everything that you're going to keep working to build out and build on in 2022. We'll keep this dialogue and conversation going. We're going to want to keep our council members updated on the progress, and again, just look forward to just seeing everything keep growing as we enter in the new calendar year. So thank you all. You're welcome to stay on for the rest of our meeting if you have time. Otherwise, we just want to wish you all a wonderful weekend and happy holiday if we don't get a chance to connect before that happens. Okay. Yes. Jim's happy hands. Love that. Okay, so moving along to, if we can get the council presentation popped back up again. Oh, thanks, Tiffany. So a year in review. Oh my goodness, these were some fun slides to put together. We've been a busy little council this year, so really happy to share with all of you. It's nice to pause and reflect on all that we've done as a council, our council members and our council staff team, so much going on, and then all of our partners that we work with across different systems. And so if we can move to the next slide. So for our full council meetings, we've held 5 full council meetings, 2.5 hours each. So a good chunk of time spent working and thinking through the issues of our day. We've had 2 special council meetings to vote on our reports, the SB 369 report, as well as our ledge report, annual ledge report. For our work group meetings, we've had 3 juvenile justice work group meetings. Big shout out to Dr. Pantoja and retired Chief Jenkins for the leadership for our juvenile justice work group. We focused on the SB 823 implementations, and in our March meeting, we spent our June meeting talking about the impacts of COVID-19 on our youth population, focusing on the school system. And as kids were transitioning, we were at the time thinking about how kids were going to be transitioning back to the school. Had some great conversations there. And then also talking about spending our September meeting talking about our legislative report recommendations. So very busy in all those meetings that spun off into work thereafter. The next one is our next slide, our diversion and reentry work group meeting. Shout outs to Dr. Hobson's, again, Dr. Hobson, retired Chief Jenkins, and Judge Manley for the leadership on the diversion and reentry work group, shaping our conversations and our content of those work groups. We met in March, really focusing on that California Health Facilities and Financing, or CHAFA, their community services infrastructure grants. That was something Judge Manley had asked about at the end of the last year, so they were able to come and give us an update, and then really spent the bulk of the time reviewing and weighing in on some of those and building out the barriers and solutions for the SB 369 veto message report. And then in June, we got that update from the Department of State Hospitals, and we just recently had a meeting on deflection led by Chief Jenkins, and then worked on our ledge report recommendations. So and then another very busy year. So four diversion and reentry work group meetings. Next slide. And then when we want to talk about our events, so we didn't just have meetings, but we also held several events and webinars because meetings aren't enough. So we held webinars. We did a webinar series in May to recognize May's Mental Health Awareness Month. And this is just presented in the order that we did it throughout the year. On CCJBH, we did our housing report launch in August. So this was the report that we did on reducing homelessness for individuals returning home from jails and prisons. And so we launched that in August, and then that rolled right into the September suicide prevention awareness and recovery awareness webinars. And I will say our lived experience contractors helped us both with the May and the September webinars. So, that was another thing that they were actually involved on as presenters. And then most recently, we were able to do a listening session on the U.S. Interagency Council on Homelessness strategic plan. So the U.S. ICH is in the process of updating their strategic plan. And so council members, we did a call out to you for information on input that we should be giving to the federal level on tackling homelessness for our population. And as always, you were so quick to respond with ideas. We were able to take that information, roll it into a listening session with our stakeholders, appreciate our stakeholders joining us and giving their input. And then we were actually able to present that to the U.S. Interagency Council on Homelessness. They were really impressed with how comprehensive and how we understood the assignment. Yeah, for those who know, you know. And we were able to get that submitted by November 30th. And then for the last thing we were able to kick off at the just yesterday is the webinar series to implement those recommendations from that Council on State Government's housing report. So that just started yesterday and is going to go on until April of next year. We also produced our bi-monthly newsletters. So we were putting that out just to get the latest and greatest information out to everybody. We've taken that now, and just as we've evolved over the year, we now have a site on our website where we're just going to continuously use it and update it. It's kind of nice now with websites. You can just do pretty on-demand updates. So we're able to do that and keep current information on that website. So we don't necessarily have to do a newsletter anymore, but it's just kind of a living, breathing website. And we're just, if there's new information, we're going to do a blast out on Fridays just to let everybody know what's new and where they can find more, additional information. And then we redesigned and revamped the CCJBH website. So if you haven't had a chance to take a look at it yet, we want to urge you to do so. And hopefully it's a lot more user-friendly and streamlined and easy to find the information. I actually use it pretty much on a daily basis to reference information. So hopefully you find it as helpful. But of course, if there's anything that, or any ideas that folks have on how to make it more helpful, we are always open to that. Next slide, please. let's see here. In terms of products that we've produced, so we were able to produce quite a bit in the way of actual tangible products that for our website. The SB 369 veto message report, again, that was about an 8 or 9 month project, and so we were able to get that delivered from the veto message mandate by September. Again, that report with the Council on State Governments that was supported by the Melville Charitable Trust on reducing homelessness for people with behavioral health needs leaving prisons and jails. We were able to do a brief overview on the CalAIM proposals that impact the criminal justice population. So it was great working with DHCS to be able to develop this cute, quick little cheat sheet for our justice system partners. CalAIM is an extremely complex endeavor, and so being able, to give our criminal justice partners or partners who are interested in this part of the work or who are needed to implement this part of the work, we wanted to get a quick product that we could have available so folks can reference it as we DHCS was going to kick off the justice work groups. And then, as Alex had mentioned, the report on successful approaches to employing individuals with lived experience in the criminal justice and behavioral health field. So this is the report that documented the results of the online survey and the key informant interviews that resulted in the identification of several barriers to employment, and that rolled into the phase 2 work. Where we're working on the report right now with CSUS on solutions to those barriers that we're hoping to get out later this month or early next month. Next slide. As I had mentioned on the with CalAIM, we were able as a council to produce a letter of support for DHCS's 1115 demonstration waiver. So we were able, so this is all part of CalAIM, and we were able to put together a letter of support to really urge and encourage the Centers for Medicare and Medicaid Services to understand the importance of these changes for our population. And then again, that feedback response to the U.S. Interagency Council on Homelessness for their strategic plan. It's like a 13-page document. It's pretty comprehensive. It's a nice one-stop shop for the issues that our justice-involved population who have behavioral health needs are encountering as a result of some of the policies and regulations that are currently in place. And so I encourage folks, if you haven't seen it or if you're involved or interested in the homelessness area or addressing homelessness for our population, it's a really nice resource to get some of the to get a compilation of that information of the changes that need to be made. We also, through our contract with the Council on State Governments, were able to publish on our website a public health meets public safety open data sets inventory. And again, this is posted on our website now. If anybody's finding themselves having to write a report or having to get information quickly on data that's publicly available related to our population, youth, children and youth, all the way through the age span. Anything that's publicly available should be in that open data sets inventory. So for example, if you need to find juvenile justice data, there's keyword search. You could type in juvenile justice. It would pop up all the publicly available data sets on juvenile justice. So we were also able to get our juvenile justice compendium and toolkit request for proposal completed and posted. We're going to have to go back out again for that because we didn't unfortunately get bids for it. So we will be putting that back out. So please be on the lookout for that. And then, but at least we got the RFP written and ready to go. And then for our Council on State Governments, mental health diversion, the training and technical assistance contract and the policy recommendations, that's in place. That work is underway and going to continue through at least the end of this fiscal year, although we might have to do a little no-cost extension on that because they're to include time to disseminate the report. And then we also had our Medi-Cal utilization project reinstated, or reestablished. So For those of you who had been tracking that, we didn't have a data sharing agreement for a couple of years. And so with some policy or with the execution of a kind of a more universal data sharing agreement, we were able to resurrect that project and just in time to analyze data that we're including in our 2021 CCJBH legislative report. So we'll have some great information on Medi-Cal enrollment and utilization for our population in our ledge report, and we're looking to spin that off into a more comprehensive standalone report, but at least wanted to leverage the legislative report as a vehicle to get some of that basic information out right now. And then again, of course, our annual 2021 CCJBH legislative report. So that is done. Many of you have already seen our recommendations because they've been posted on the website for quite a few months now, but we're just in the process of finalizing that report, and we will plan to have it posted to our website by, or at least submitted to the legislature and shortly after posted to the website to complete that mandate and have that information available for everyone. As always, we use our ledge report as a one-stop shop resource for the latest and greatest summary of all the work that we've done in the council and what's coming up for the next year. Next slide. So with our 2022 priorities, we as council staff worked really diligently in November to kind of look at the work that we've been doing, kind of what's the latest and greatest in the field and all the work and all the budget investments happening right now, and thinking about what's on the horizon and using all the information we had available at our fingertips, put together a proposed plan for game plan for 2022 for our full council and work group meetings, as well as our projects, and which we want to present to you today for review and feedback. So I will walk through it and then we'll open it up so we can have a 2022 planning discussion. Next slide, please. So for our priorities for 2022, continuing to our work to strengthen services. So there's so much going on to strengthen services with CalAIM, but not just even CalAIM alone, but we have the Behavioral Health Continuum Infrastructure Program. We've got the diversion programs, dish diversion program. There's so much going on across systems. So wanting to continue our work, continue tracking all those great projects. It's just no time like, I just can't even remember a time there's just been such interest and investment, and it's just we're just taking that ball and rolling it down the field as fast as we can. So we as CCJBH just want to make sure that our our what we call our BHJI or behavioral health needs population who's involved with the justice system are going to be able to benefit and are going to have a chance to benefit from those services. Again, we're working to continue our efforts in housing. So continuing to advocate for housing for our focus population. Through our work with the Council on State Governments and implementing the housing report, but also with the Homeless Coordinating and Financing Council, who will become the California Interagency Council on Homelessness, and they'll be launching their justice work group later this year or later 2022. And so we'll want to make sure that we're staying really locked in with those efforts, making sure that there's housing available for our population. Next slide, please. And workforce, a lot going on in workforce, and wanting to make sure that we're tracking all those efforts that are happening with workforce to make sure that there's a workforce that can address the needs of our population. We're looking to link up with the Healthcare Access and Information Department, which used to be OSHPD, the Office of Statewide Health Planning and Development, but they've got funding for building out workforce. And so this kind of ties in with some of the thinking and the preliminary work we've been doing with the Forensic Peer Support Specialist classification that we want to continue building out in 2022. Also with data, so we've got the Public Health Meets Public Safety work, and there's the dashboard that we're looking to create, and we're doing that with the Council on State Governments Justice Center and building out a framework for that. So we'll be looking to kind of finish solidifying that framework, and once we have it, which we're estimating for the January council meeting, bringing that data framework to our council meeting so that we can get some review and input and some expertise here with our council members as well as any of our attendees. And we've also, this is actually another area where our lived experience contractors have been helping to help us refine what information is pertinent to this population and how we can present it. And then also, of course, with the Medi-Cal utilization project and keeping that moving with the data share between California Department of Corrections and Rehabilitation and Department of Healthcare Services. Community involvement. So again, those keeping our work groups going. So we're proposing to keep our work groups going. We think that they're very valuable. We as council staff think they're very valuable. And so hope you find that as well. So we can continue working on that. And then also with education. So continuing our work to promote information sharing, promote anything that is, helping to propel our field forward. So like our webinars and all that work that we look to do to keep networking that information. Next slide. And so with that, well, the last thing is, so those are a lot of the projects that we've been working on that we're proposing to our council members that we continue working on as council staff. And then for a couple future projects that we were kind of tracking is, it's our 20th anniversary next year. So very exciting. And so I know, right? Can you believe it? 20 years. We used to be called the Council on Mentally Ill Offenders, and we changed our name a few years ago to Council on Criminal Justice and Behavioral Health. But nonetheless, the work of the council members has been, really ongoing for 20 years now. And so we want to reflect on all that time, how far we've come, and where we want to go. And so we as council staff would like to kind of think through some of the 20th anniversary events or information or just different activities that we can do to acknowledge all of this wonderful work that's been done by the council over these past 20 years. And then the other thing we're proposing is to reinstate the Best Practices Awards. So for those council members who have been here for a while, we discontinued Best Practices Awards for a while because there was some confusion in terms of like how to select folks for Best Practices Awards. And so we kind of had put it on the back burner. I know when Stephanie was here, we'd done a little work group. I was a council member who was working, I think Judge you and I were doing that with Stephanie. I can't remember if there was anybody else working on it with us, but nonetheless, we're proposing to reinstitute the Best Practices Awards so that we can really highlight those wonderful programs that are happening out there and really lift them up to give other entities ideas on perhaps spreading those or adopting some of those programs and practices. Next slide. So with that, we've put together proposed full council meeting dates and topics. And again, these are based on our conversations from the past year, our legislative report recommendations, as well as just kind of what's going on in the field right now. So we've got several meeting dates and looking to focus, continuing the conversation from the diversion and reentry work group on deflection this last, I don't know, what was that, like a week ago, I think, but moving it into a larger discussion in the full council meeting, because there's some great work that's going on out there that we think would be great to highlight. Engagement, always a significant issue. It's come up so many times in so many different forums of like how to increase and promote engagement of, so that our population is receiving the services that they need and that they want, and in a way that they would like to receive those services. Workforce, building out workforce, so continuing that work for forensic peers, the work in trying to just build out employment in the behavioral health and criminal justice, and not just those two sectors, but we want to go broader and think housing and social services, just different sectors to build out workforce for particularly peers. And then continuing our work with housing and so the CSG report recommendations, but also any local entities that are looking to build out housing infrastructure locally. And then of course, juvenile justice as another focus of our council. Next slide. And then for the juvenile justice work group, we've mapped out dates for the work group and some topics of focus. So again, another Office of Youth and Community Restoration update. The plans for SB 823 are due in January. So maybe we can get an update on the plans in February, as well as the Children and Youth Behavioral Health Initiative. We have a new executive director in that area, and I've just heard her speak at the Behavioral Health Task Force meeting, and it was really it was really inspiring. And then our school-based substance use disorder and mental health services, as well as our tool compendium and toolkit, talking about that in May. So going a little bit deeper, we had some great conversation last June on those school-based services. And so maybe we could continue some of those conversations. And then of course, our ledge report recommendation. And then another one topic that had come up in our juvenile justice work group was the juvenile hall to school transitions and how we can help kind of strengthen that process for kids. And so maybe we could have some recommendations coming from that. And then last but not least, well, second to last but not least, our diversion and reentry work group set out some meeting dates there, looking for to start off with our incompetent to stand trial work, the IST work. The Department of State Hospitals had their IST solutions work group. So hearing from them on some of those solutions and how they're looking to implement some of those solutions. Again, engagement and effective programs, our ledge report recommendations, and then looking to follow up on CalAIM and the BH Continuum Infrastructure Program and Continuum of Care expansion for housing and supportive services for our population, for those who would need those types of services. And then last but not least, I believe, we have our special events. So we were having a hard time squeezing everything into council meetings and work group meetings. So we started developing this little running list of other potential special events. And so continuing on like last year, our awareness months, but our dashboard presentations, we might roll that into the January meeting, but we just wanted to make sure that we're tracking that with our Public Health Meets Public Safety project. And then maybe a diversion report. So our diversion report with CSG is going to come out by the end of the fiscal year. So maybe next summer, having them report on those diversion recommendations. And then of course, our suicide prevention awareness and recovery awareness activities, and maybe doing something in October with forensic peers. There's the Alameda County Justice Restoration Project that we've had put on our radar, which is a pretty exciting project that's showing some strong outcomes in terms of positive outcomes. And then a few other ideas are ACE's presentation. We wanted to do that this last year, but unfortunately with COVID, our Surgeon General and her team got very preoccupied with ACE's work with COVID. And then we've been working with CDCR. We as council have been working with CDCR mental health program to design like a mental health program 101 for our county behavioral health staff team members, as well as I also could see it helping our managed care plans. So as these entities are working with our prisons for that transition, knowing what services are provided while, like basically a delivery system presentation, what services are provided to this population of individuals with mental health needs, and then how folks are rolling out transition and how that transitions to the community. And so, and then of course, all these webinars would be available to we'd have everybody, it open to everybody. And then there's also social finance has been doing work on in Santa Barbara using data and linking data together. And so they had approached us as well as potentially presenting to the council as well. So that's kind of what we've put together for our to-dos. Next slide, please. So was there anything else? Oh, I just wanted to note too, AB 361, I think we flagged this last time, but want to just remind everybody that we're still continuing to stay virtual as under the emergency, the public health emergency. So have not heard when anybody could return to doing these meetings in person. I know, especially with Omicron coming out, we're still wanting to be very safe with COVID. So so we'll continue to meet virtually. Next slide, please. All right, I'll stop there. And I will say for our CCJBH project updates, we aren't going to go through these slides. So we can probably pass these slides, but they're informational only for it, just so everybody kind of gets an update on the different projects. So let's open it up and and talk about 2022 priorities for our council members. Thoughts? Does this seem on track, or and yeah?
Well, this Judge Manley, do we have to make these determinations right now?
No, I just figured we could have an open conversation. We are trying to lock it down. We have our January meeting that we're planning for right now, and we do have a potential speaker presenter for the January meeting on deflection, talking about the SHORE program here in Sacramento, the one I mentioned to you a few times, Judge, and then we talked about when we had our diversion and reentry work group meeting. I think that was one of the things we talked about, having that roll into a full council presentation. So we've been working on that since we last met.
One thing, that I wanted to suggest, and maybe, I know you went through this very quickly and we're short on time, but I really think we should be concentrating on the implementation of CalAIM. I mean, this to me is a game changer in what we can do at the local level, particularly with our county jails and the challenges we have. And so I really hope we focus on that. The second one, and I didn't hear this, but maybe it's in there, is that we keep on top of the issue of treatment capacity building. I simply, at the ground level, and Dr. Hobson's here with us today, I do not see any dramatic changes in addressing the issue of the lack of sufficient treatment for the individuals who unfortunately get caught up in the criminal justice system. There are simply not enough options, whether you talk about diversion. We now have a new statute that requires us the judges are giving very few choices in terms of misdemeanants who are found incompetent to stand trial. And without treatment capacity, because these individuals who do get caught up in our criminal justice system, it is not the place they should be. And yet we are told that we must now simply put them out into the community in diversion or some other program, assisted outpatient treatment, assuming they would qualify for it. And there are no treatment programs available or facilities to work with these individuals. And every year, the legislature revisits the issue of conservatorships. Again and again, statutes to broaden the definition, and which would mean that potentially more individuals could be conserved. My problem with that is not the idea behind the legislation, because it's not up to the courts or any judge to be telling people tell the legislature what their priorities should be, or who should qualify for a program or not. My concern is no one is addressing the fact that we do not have sufficient treatment capacity for these high needs individuals who are caught up in our criminal justice system and are being warehoused in jails. As we reduce the population in jails, I have noted that the number of individuals who are mentally ill increases. It does not decrease. And the reason, in my view, is that we don't have a system that works for them in terms of providing the basic and fundamental treatment capacity they need outside the jail. And I think, with the CalAIM program coming into effect, we have a once-in-a-lifetime chance. And the governor and the legislature, I think, is over $2 billion for capacity building. And I think this should be a real priority of ours to support this, push it, try to see if we can't measure it. No one's really measuring treatment capacity that I know of. in a meaningful way. And I become very frustrated. And I know a lot of judges in California are frustrated with the fact that we do not have the options that we need to move people out of our system into the public health system through treatment. And I deferred, of course, to Dr. Hobson because he's far more knowledgeable about this issue than I am. I just see it on a daily basis in one county, but I talk to judges in other counties who have this same frustration. They would like to do something about it, but there's nothing they can do.
Thank you.
So I just think it ought to be a priority of ours.
Yeah, no, I agree. And so, well, I guess a couple things. One is we do want to, so going to your first point on CalAIM and making that a priority. So that is something when I said continue working to strengthen the services, that's kind of where I was thinking that CalAIM bucket would be, because we'll just continue working on it. I know a lot of us are on those work groups with DHCS and trying to help build that out.
Right.
Are you thinking, because we have, I put it on for diversion and reentries work group for November presentation on the continuum, the BH continuum infrastructure grant. So you remember those grants that,
right.
Yeah. So there's the grants and then continuum and care expansion. So if we can get some updates from the departments, healthcare services and social services on that, on the efforts there of how it will benefit our population. Are you thinking maybe not so, is that not enough or not the right timing, or you think it should be somewhere else?
I'm just thinking we should move it up and start, addressing this as soon as possible. I mean, I'm trying to do it in working with judges and, encouraging them to weigh in that this is a critical issue.
Yeah.
But I just think that this is a once in a lifetime opportunity. If the waiver is approved, good heavens, we can do so much more than we can do now. And so much of what we're doing, our peer groups, peer navigators. I mean, this could be a part of the entire CalAIM system. And we want to push for that, rather than to have this be something different, than all this work we've done to date. And I just think it's something that we should make at the top of the list, along with capacity building.
Yeah, well, I'll have to go back. So I think the reason for the November timing was to get an update on it, because I think the grants, I'll have to go back and look at all the timing of the grants. And I don't know, Jim, do you know what they are, like off the top of your head? The different phases for the grants?
I can get that for you to find out when each of the waivers is going forward.
Because I know the gap analysis is supposed to come out soon, and because DHCS had worked with UC San Francisco to do a gap analysis to identify those gaps across the continuum, and then make grants available to fill those gaps. And so that's why I was thinking they'll need time to have those grants come in and be able to process and award them. And then so we could get an update once that's done on kind of what's happening with those grants and what's going on. But I think what I hear you saying, Judge Manley, is you're wanting to somehow influence how local folks apply for those grants.
No, not influence them. I want to make sure that we're all aware of what's available and what's needed.
Mm-hmm.
And I mean, we meet year after year and we never address this, we never get an answer that I've ever heard. And I just think it should be a priority. I mean, someone has to stand up and say, this isn't working. What do we need to do? Maybe, I'm just suggesting our council could weigh in on this in a report to the legislature and the governor. And so, but to do that, we would need presentations and find out, just as you have mentioned, what are the timelines? What should counties be doing so that we can kind of support moving forward here instead of simply waiting for another report, and and the same with CalAIM. My concern is that, and I can only give one example, my own county. I looked at the managed care plan. They are talking about implementing a number of the CalAIM
supports, community supports.
Yeah, well, they changed the name of it now.
It used to be in lieu of services. It's now
right now it's but they're talking about January 22. Okay, now January 22 is around the corner, right?
Yep.
I mean, we're 1 month away. Well, they're ready. Well, if some of these managed care plans are ready to move forward now, we ought to be up there talking with them, and giving suggestions. I'm just put that out there because I find it, I hate to miss opportunities.
Agree. Okay, that's helpful, Judge. Thank you.
That people will listen to us.
Yep.
Hopefully.
Yep. Don't they always?
Something quickly too.
Yes, and I was just going to say this little time check real quick. It's 4:22. We have Chris and Tracy. I know we do want to do a little public comment too, and then wrap up at 4:30. So Chris, and
thank you.
Yep.
Yeah, thanks, Brenda. I actually just wanted to also just express my support for what Judge Manley was expressing. I think one, right, I do think it is important for us to kind of have a good understanding of where things are heading with BCHIP, and to be really thinking about this. It'll sort of help promote one of the areas in which or a couple of areas in which we are sort of focused on, which is, optimizing the delivery of the services and really thinking about how are we going to leverage these opportunities between that and CalAIM. How do they work together so that we're, working together versus working against each other, as well as all the DSH opportunities that that are available as well. And then that we are tracking SB 317 as well, and the impact. So it'd be interesting to hear and understand how counties are implementing or what the impacts are of that law change, so that we can be thinking about and incorporating that sort of, I guess, lived experience, for lack of a better term, into our program planning.
Great. Okay. And then Tracy?
Yes. I just also wanted to support what Judge Manley had to say. It's also been my experience that there's a great gap in capacity, and that folks are staying in jail who are there because of behavioral health concerns in the first place. It's also been true in Los Angeles that as our jail population decreases, the percentage of folks with mental illnesses is increasing. And we hear from different stakeholders that there are enough services, but yet there seems to be a disconnect between people thinking that there are enough services, or that there appear to be enough services somehow on paper, but yet somehow those folks are in jail not getting those services. So I don't know whether it's an issue in accessing the services, or whether we have a more fundamental reporting problem. I mean, I'm a justice stakeholder. I'm not a healthcare stakeholder. But one question that I would ask is, in the reporting of services that the counties do, both outpatient and inpatient, are they separated by whether their services generally available to anyone in the county, or whether the justice involved individuals are not allowed to use those particular services? Like, are they separated, between, because what I'm saying is maybe non-justice involved individuals can access those services, but justice involved individuals can't. I don't know what the answer is, but I'm just saying, I think there's a giant problem here that Judge Manley is discussing, and I think it's really real. And if there's something that we can do about it, having a historic opportunity now, I think we should explore that further.
Okay. Now, this is super helpful conversation and brainstorming. So I think what we'll do is we'll go back. I guess there's one question is, for the other things that are on there, I mean, do the general topics look on point? And then we're moving the CalAIM and continuum infrastructure conversation earlier into the year. That's why I think we're saying we want to do. Okay.
Well,
And then we
yeah.
can figure out and build it out like how we do it. Okay. All right.
Yeah, Brenda, I mean, Judge Manley mentioned my name a few times. And I wholeheartedly agree with him. So yeah, I think this needs to be a priority.
Okay.
And to Tracy's statement, I can just speak for where we are. It doesn't matter if they're justice involved or not. The services are available.
Yep.
I think that's the case in most counties, actually.
Yep. Agree. Okay. Well, that was super helpful and a good conversation. So appreciate you guys putting the time into it, into thinking about it. And like I said, you know, we don't have lots of time for planning, and we want to make our planning public, so we get to do it in this forum and try to balance out. We only have like 4 meetings a year to do this, so so really appreciate you guys taking the time. If you can look at it, and if any of the council members have other ideas, you know, after digesting it, let us know. And one thing I didn't note that we stuck on the slides is that these can be subject to change based on priority. So if there's something, I mean, this is kind of a sketch out of the year, so we know what we're kind of planning for. But if we decide as a council or our council members decide that we need to do something different, we can always, I mean, this is our own calendar. So we're just kind of trying to map out as council staff what we can plan for the future. So it helps us secure speakers and make sure that we're tracking the right information for everybody. Okay. All right. So with that, I know we only have a few minutes left, but can we open it up for public comment? Is there any
hands raised here, Brenda?
Okay. Okay.
Nope, there goes one. Let me.
Stephen.
Yeah. Let me go ahead and unmute him.
Stephen and Kit.
Okay, Stephen, you should be able to.
Hi, my name's Steve McNally. I really hesitate to make the public comment, but I'm inspired by Judge Manley's comments and the lady's comments from LA that I'm not as familiar with. I'm gonna ask for your help, and that's to consider providing direct assignments to your local mental health boards across the state. They're state mandated. They have a ton of shalls in the state mandate. Very few of us are allowed to do any of the shalls. We really need to get a better coordination between the MHSS OAC, the California Behavioral Health Planning Commission, and the local boards. What the local boards provide are 900 plus community members, including 59 honorable supervisors that have a lot of shalls to gather information and spread the workload. I know there's mental health diversion in the state. I don't know where to find which counties are doing it and aren't doing it. I know people want to expand collaborative courts in my county. I can't figure out who the person is to go to find out how much money does it cost. If I ask the question as, what actually is needed for getting the barriers to money, funding, or egos or territorial claims, what would it actually take just to solve the problem? And then go let me find the money for you. Because we have tons of money, as we know, goes unspent with MHSA. So again, I am on a board. All my comments are my own. They are not reflective of any personal or private appointments. I must say that because I'm driven by living the family journey. I've been given a great gift. All of my relationships with my loved one have been restored, and I give that gift freely to others. It's not near as difficult as it's made out to be in our county or in our state. We have tons of money. So CalAIM seems like a lot of money. MHSA seems like a lot of money. As the auditor knows, we're not spending it, and it wasn't a secret since 2010. It's never a secret, but for somehow we allow this to happen. We have to up our game And already I was at a managed healthcare plan and they're talking about that pharmacy benefit and all the issues and concerns they have about the pharmacy benefit just released from CalAIM. And when listening to it, it's as if the managed healthcare plan was either not at the table or not heard, or it's unclear. So as the lady from LA said, let's just get the information, as I said earlier about psychological safety and being able to just express opinions. Let's get the looking good out the door. Let's just manage. Nobody's expecting perfection. We just want expectations managed and met. And CalAIM has already been set up as this incredible expectation funding. And if you don't let us all in the room to help implement it, it's just going to be the members, the leadership at CalAIM. I've sat in on the meetings. They seem terrific to me. They seem really aligned with families and loved ones. But between them and us are tons of blockers, and we got to really be aware of it, or we'll be doing in year 17 of MHSA. We don't know capacity. We don't know infrastructure. We don't know outcomes. We don't know what works, what doesn't work. And we consistently don't spend a lot of them, large amounts of the money. And what we do spend maybe spends at 80%. And once we let the county take its first 15% of admin and then a provider 15, and we block the local community organizations because they can't get through a county procurement system, the problems are known, the solutions are known. What's not known is why 59 behavioral health directors are allowed to lead us down this road. And I'll leave with this because I know that makes everyone feel uncomfortable when I say it. It makes me uncomfortable to say it, but ultimately accountability for at least the MHSA money, which is separate from your money, but analogous and sometimes can be complementary, falls in the hand of a very small amount of people that somehow just gets to walk away from the accountability of it. We can do better for our loved ones. And thank you, Judge Manley and the lady from Los Angeles for bringing it up. If I made anybody feel uncomfortable, I apologize. People's lives are just too important for us to continue the way we go in California. Thank you.
Thanks, Mr. McNally. And that was Tracy Whitney, District Attorney from Los Angeles County, District Attorney's Office. Okay, so looks like we have one more comment. For council members who have to leave, totally get it. If anybody has to pop off, I do want to do our last comment though, and then wrap up for today.
Hey, Kit, you should be able to unmute yourself now.
Oh, scary. I just wanted to, I just typed that nice little note in there so you guys could all leave. But I just wanted to thank you all personally for all the work that the members and Brenda and all of you on the staff do for Words to Deeds every year. I mean, Brenda is a really active participant in the Words to Deeds leadership group. So you have great impact on the curriculum that we did for the Words to Deeds track last March at the Forensic Mental Health Association annual meeting. The Words to Deeds 15 contract, we kind of started when you guys started, as you recall. So, you know, it's invaluable, and already we're planning the Words to Deeds track for April 2022. So thanks very, very much for that support. We couldn't do it without you. And really thank you for all the amazing work that you do above and beyond the call of duty, because it's not like you all aren't busy in your own lives. I mean, come on. So thank you for improving the lives of all Californians, and happy holidays and virtual huggage to all of you. You're heroes. Thank you.
Thanks so much, Kit. Okay, I see Cheryl, you have one last hand up, and then because I do want to make sure we get you, Cheryl.
I just wanted confirmation that someone will be getting back to me to let me know how my son could get restored and stabilized from his the beating from prison guards and all the other adversities that he suffered, basically stemming from his mental illness.
Yes, Ms. Canson, we will follow up with you. I'll ask my team. We'll follow up with you after this.
Thank you.
Yeah, thank you. Okay, everybody. Well, our last slide was just wrapping up to say thank you to everybody. I just really appreciate all of our council members. Oh, you don't have to pull up the slide. Well, okay. Our next full council meeting, like we mentioned, is on January 28th. And then we have our 2 work group meetings in February. As always, for those who are our attendees, we have our website and our email address. Anybody who wants to join our listserv, we have that link as well. Really want to say thank you so much to our council members. I know we're wrapping up this year, and you know, we can't do this without you. I mean, we're here to support you, and you know, we want to do a great job for you, and really want to appreciate all the time that you've spent in conversations and advising us, and being so quick with the responses for our you know, all the work we've done with the CalAIM letter of support and the housing strategic planning. I mean, it's just anytime we're asking you guys for information or even just thinking of things through the ledge report, you're right there to weigh in and respond. And just want to thank you for all of your time and generosity with your expertise as well. And also want to give a shout out to our council staff team. So we've got Monica Campos, Liz Castellan-Weiss, Jessica Camacho Duran, Kathy Hickenbotham, Emily Grishon, and Paige Hoffman. Well, not with us is Angela Krantz, who was our research scientist 3. And we also have Daria, who joined us as our student this year and did a lot of work with Mac on the deflection work. So just really want to say it's just a pleasure having the opportunity to work with our council members on this extremely important issue, and to all of our attendees who join our council sessions and provide their expertise and share freely with their thoughts as well on our work. And with that, last point is our housing webinar series link just got dropped into the chat. Thank you so much to my team for doing that. And you know, we'll go back, we'll digest some of this information, make some adjustments on our council schedule, and we'll bring it back on the in the January meeting as well. And again, we can just always tailor as needed. So everybody have a wonderful, wonderful holiday. If we don't talk to you beforehand, thank you to our presenters today, and we'll look forward to seeing everybody in the new year.
Thank you.
Thanks, everybody. Happy holidays.
Thank you.
Thank everyone.
And thanks for staying a little later, everybody. Take care now. Bye-bye.
Happy holidays.
Thank you, everyone. And thank you, Brenda, for moderating.
Oh, thank you. Take care, everybody.